Hi, welcome back to Balanced with Bailey. Today I am here with Dr. Amylia Shayne. I am so excited in honor of Women's Health Month, and it was just Mother's Day. So who better else to have on the pod than you?
Thank you for having me. I'm so excited.
Of course. For the people who don't know much about you, give us a little debrief on how you ended up here.
Yeah, my goodness. So I started as a bedside nurse. I graduated with my undergrad in 2013. I was a peds bedside nurse for a really long time. I did some travel nursing. I ended up in like the pediatric ICU for a while. And I kind of always knew that I eventually wanted to move into the role where I could manage patients as well as care for them. So I did Gonzaga's DNP-FNP program. I started in 2017, pre-kids, and said, like, I'm going to bang this out really quick in 4 years before we have babies. Found out I was pregnant like 6 months later.
Perfect.
Yep. So, the usual, mom, I ended up doing all of it at the same time. I had my first baby right before I started clinicals. I had my second baby like a month before I graduated. So I was breastfeeding and studying for boards, and again, just always doing everything at the same time. That's just kind of how life goes, I think. And when I finished, so my program finished in 2021. So I survived COVID through school, got out and started working in urgent care in like the Delta wave of COVID, COVID 2.0 or wherever we were at that time. And then my family and I moved here from Seattle in 2023, and I started working in urgent care. And I started to realize that I didn't know if I'd ever want to stay in medicine, if this was the type of medicine I was going to have to practice for the rest of my life. And it felt so awful to have that feeling of like, I've worked my entire life to be here. Like my parents joke that I've like been a nurse from like day one, like this is just who I am. Mm-hmm. And to have that feeling of like, oh my God, I don't know if I want to do this was awful. I was missing birthdays. I was missing bedtimes. It just in urgent care medicine, you get 6 minutes to see patients and then you're supposed to turn and burn, right? Mm-hmm. And it was myself and my co-founder, Catherine, our husbands are actually best friends from college, and we ended up getting jobs at the same urgent care. And one day we sat in the back of a Starbucks and we were like, okay, like, if we could practice the type of medicine that we actually want to practice, what would it look like? And do we think anyone else even needs this or wants this? And we kind of bet on the fact that if we were feeling this way, there had to be other women that were feeling this way. And thankfully for our business, we were right. I'm really bummed for women that that's the case, and that this isn't the standard of care that we're all receiving. But that's kind of where Bloom was born, was in the back of a Starbucks. And now we are 2 years into Bloom Women's Health, and we have like this beautiful full clinic space where women now feel heard and get to be a part of their care. And I just think that we are finally getting to provide the type of medicine that I always thought I was going to be able to provide. And it was kind of this weird wiggly road to get there. But I'm really thankful that that's where we are now.
And I feel like every nurse kind of has that moment of like, wait, what am I doing? Like healthcare is not what you're told through school. It's not what you're told and like what is seen like on the internet and things. And everyone kind of has that moment of like, wait, what am I doing here? Like, is this actually helping? Or like, am I just a number to a hospital system? And I think that's a huge part in a lot of people's nursing careers that's not talked about. And like, that's why I ended up moving outpatient and doing surgery. I know Maddie last week on the pod kind of had the same thing of like, wait, this isn't where I'm supposed to go. And I think that's such a pivotal moment that every nurse goes through. And I love that you stuck with it and we're like, no, I'm going to pave my own way. Even as a nurse, starting your own business, like doing something you were not equipped to do and raising kids at the same time. You're like, I'm actually just going to go full force because if I need this, someone else does. And like that proves you as a nurse, and like deep down, everyone comes from that point. And it's just like so unfortunate that it has to like reach that for things to change.
For a lot of us, it feels like you said, like there's only two paths. Like, and I think a lot of us, especially working through COVID and those kind of things, like the quote unquote healthcare hero. Like I think a lot of us have that kind of angel complex. Like I remember being in nursing school and like my parents were so excited to tell people that I was a nurse. And every time I went on a date and I told a guy that I was a nurse, like you get that response of like, oh my gosh, like you're just this like amazing person. And I think it's really hard to kind of move away from that like sacrificial martyrdom of like, but I'm doing something that really matters, right? And I still felt that way. Like I remember as a bedside nurse, like I loved getting to care for children, but I didn't always agree with how we were doing it, right? And it was like, you drink the Kool-Aid or you don't drink the Kool-Aid. And like, we were all pipelined to work in the hospital. I never even like, for a long time, even imagined what it would look like. I couldn't even fathom what it would look like to not work in the hospital, right? Like, I went to nursing school to be a peds-onc nurse, to work at this children's hospital for the rest of my career. And that was like the end all be all at 21, right?
100%.
And the idea of starting to move away from that, I think, even in like NP school, same thing. We get pipelined to work for a big organization. Like, we do not get any business classes. I didn't learn anything about accounting. I didn't learn anything about business ownership, nothing. Like, I really do feel like most of the advanced degrees should be like an MBA, DNP combo or something. Like, you should be forced to take some business classes, even if you decide to work in the hospital for the rest of your life. And I'm so thankful that there are people that love that work and we need them. But it's unfair to prepare us to literally be pipelined to do kind of whatever they're paying for, right? Like,
No,
I mean,
totally.
unfortunately. And so the idea of, I think too, medicine feels very like secure. Like, my dad owned a small business growing up, and like that was one of the pulls to medicine for me, was that like I was never going to be a millionaire, but I knew exactly how much I was going to make, and I was going to have good health insurance, and I was doing something that mattered. And the idea of leaving that security was so scary for me. Like, I literally had a part-time job until March of this year because I was so scared of that idea of like completely jumping into being an entrepreneur, being self-employed, that like that was so ingrained in me that like this was safe. And I think the safety can keep us from being willing to jump a lot of times.
And nursing, I feel like it's always, there is no safety in nursing. Caring for your patients, you never know what's going to happen.
Oh my gosh,
You could walk into a shift and have the best day of your life, or like literally the most tragic thing could happen and like alter
And
your entire year, and
Yes,
dangerous
yeah.
for you and your patient, the people around you. So I feel like that safety of it, of knowing you're always going to have this check, of you're going to be there 3 days a week. Like that's the only consistent thing you can cling on to.
Yeah, it's like a veil.
And then it's like when you start to have these thoughts of like, wait, what else can I do? Because everyone always talks about nursing so diverse. You can do whatever, whenever. But when you actually decide to do that and the pushback you get, people don't realize. Like telling people I was going outpatient, the first response is like, oh, so you don't want to be a real nurse anymore.
Yep.
We're still intubating people.
Yes,
We like things can still go wrong no matter what type of nursing you're doing and whatever's happening. Like someone is trusting you with their life in your hands. It should not be such a stigma. But I think there is like this secret thing within healthcare workers where it's like it's not taken as seriously or you're not seen as much. And I think that comes back to the education in nursing school and being like, oh, well, you pipeline into these, like you want to be in the ICU straight out of school. You want to be in the most like sought after unit, even though if that's not what you want to do, if that's something that you might not just like thrive in that, but you do it because you're supposed to and everyone looks at you that way.
It's very competitive, right? And it's very female driven, which unfortunately is also very competitive. Which I'm hoping that we're changing that at some point. I mean, it just drives me crazy that women's version of competition is to like step over each other and like only one of us can be at the top, right? Whereas like guys all the time, like my husband was the president of his fraternity, and like the camaraderie, like they're super competitive
brothers,
but for some reason they're like yanking each other up as they're competing to the top, right? Like they'll punch each other and then they'll be best friends on the back end. Whereas like women, for some reason, we have been taught from a very young age. Unfortunately, I have a 7-year-old daughter and I see it already, that like it's me or her. Right? Like that competition, same thing. Like, well, only some of us are going to be able to work in the ICU straight out of school, or only some of us are going to get into this program. Right. And unfortunately, like we're fighting with each other over here when we should be fighting together
against the problem.
Like, so much more. Exactly. Like
it's so much deeper.
Over this little tiny crumb that somebody gave us.
Yeah.
What the hell are we doing?
Yeah.
Yeah. Driving me crazy.
No, 100%. And then finally getting that, like, I didn't take a single finance class in nursing school. Didn't take anything like.
I had to take statistics, and that was like literally just for a college credit. Like,
I could tell you anything about any medication basically, except for like how to pay off a loan or like what a car loan is. Like things like that where you're just like, how are we missing things like that? Like I've never opened an Excel spreadsheet. Like, literally, I remember my roommates who were in business were like, you've never touched this app? I'm like, no, I have no idea what that is. Like how to track expenses or anything like that. Like now owning my own business and like learning about write-offs, learning just the basics of it. I'm like, I knew nothing going into it.
No.
So when you and Catherine started Bloom, how did that, I know you kind of explained how you got to that point of starting it, but when you guys actually sat down and were like, okay, what the hell are we doing? Like, how was that journey in the beginning phases? Because
Yeah.
she's also a nurse.
Yeah.
Did you just build it day by day, see how you win? Or was there like time where you really sat down and put like thought into it? Or were you just like, let's do this?
Yeah. No, we thought about it for a long time. We probably thought about it for over a year. We also were really stuck on the ability of like working within the system we were in, right?
Mm-hmm.
Like that's what kept us, I think, from opening for way longer than I wish it would have. Cause we were like, well, there's no way we can't accept insurance. There's no like, here, how are we going to do this in the way that we're already doing it? And we just kept coming back to like, but the reason we're leaving the system is because the system is broken.
To be different.
And like,
Mm-hmm.
this is not good care, right?
Yeah.
We're working in that system and we're not able to provide good care. So why do we think we're going to be able to do that in the exact same system? But that was what we were taught, right?
Mm-hmm.
And so we kept going through it and going through it and going through it. And like, I think some of the areas that we were really smart is like we really focused, being millennials, I think we got lucky and like social media was something that was already well ingrained in us, and branding we knew was going to be really important from the beginning. Like we didn't want it to be just us. Like I didn't want to be like some solo injector or some solo health provider. I wanted to build a practice. I wanted to build something that was going to be sustainable outside of just her or I.
Mm-hmm.
And we had that, I think, forethought in the beginning, which I'm really thankful for. And so we did a lot of the like branding and front end stuff at the very beginning, which I'm really thankful. We even went through a rebrand like 6 months in, and I'm so thankful we did it then instead of having to do it now.
Yeah.
But like we rented a 200 square foot little solo salon suite that we paid week by week. And we started posting on Instagram about like what we believed in, the type of patients we were hoping to help, what it would look like to be a patient there. And we would get, a random booking at 9 a.m. and a random booking at 4 p.m. And my babies were 18 months and 4 at the time. And it was so hard. Like I just remember when the first winter we were here, because Catherine and I opened the September that we moved here in June. We opened in September. Catherine got married in September. We opened our clinic, and like that winter was like snowmageddon. And my kids had like 2 weeks back to back of snow days where like school was canceled, and we're like frantically trying to figure out, how to divide tasks and how to do certain things. And I just felt like I was dropping the ball across the board, right? Like I wasn't being fully present with my kids because I was trying to build this business, and I wasn't being fully present with this business because I had my kids at home. And, it just felt like this impossible equation, I guess.
Mm-hmm.
But when we first opened, we literally were just like taking every single patient that walked in the door, and we're trying so hard to figure out like, how do we build something that's sustainable so we can keep our doors open?
Mm-hmm.
And what would that model look like? And we have definitely, the model has evolved over the course of the 2 years to where it's at right now. And we kind of really we learned a lot of trial and error. I think some of the business things that we got right away was we got a really good accountant in the very beginning.
Mm-hmm.
Neither of us are freaking accountants.
Yeah.
And like that's something that I watched, like that was a downfall for my dad's business, was he hired the wrong people and didn't know how to do things, but decided to still do them himself, right?
And not
and
ask
there was,
for help.
like you're saying, like the tax write-offs and these kind of things where I'm like, now that I look back, it like makes me so sad to think like there were so many places where like he built this incredible business and he didn't really get the value out of it, right?
Mm-hmm.
Like, and so I think we were really smart about trying really hard to put the people in place to do the things that we didn't do well.
Mm-hmm.
So like the accountant from the day, from day one, Catherine and I have different strengths. We leaned into those. I think we have, we've done a really good job of figuring out like being partners is hard.
Mm-hmm.
The first thing everyone tells us, because we're 50-50 partners, the first thing everyone tells us is like 50-50 partnerships don't work. And we're like, why? First of all, why would you say that? Like,
yeah, thank you for the opinion I didn't ask for.
That's your first like business advice. Like, thanks a lot. But we've done a really good job. We've communicated really well. Our husbands have been best friends for 10 years. We've been good friends now for almost 10 years. And it was really important to us that like, this was both of our idea.
Mm-hmm.
And like, it was really important to us that like, we built this together. And we've had our moments where, I thought something was really important and she didn't, and vice versa. And we've done a really good job, respecting each other, I think. And luckily, the one thing that's always aligned for us is what our vision for Bloom was. And so it's always been really easy to kind of come back to that. And that's felt really organic, that like, that was always the driving factor for both of us. And it's been that piece of it has been very consistent.
Mm-hmm. Yeah, I think being 50-50 partners is, actually amazing that you guys do that and make it work because again, it comes
Yeah.
back to being
Yeah.
women and just
Yeah.
like naturally you have that instinct of like, oh, but I want to do this, or like just to slightly like prove to yourself that you might be a little ahead or just like more organized or whatever.
Yeah.
So I think it's amazing that you guys are able to lean in on each other and lean in each other's strengths. Have there been have there been times where you're like, what are we going to do? How are we going to move forward? And how do you solve that and come together and like communicate that with someone and have that hard conversation, especially when you're so close, your husbands are so close, you have a business, like your families are close, like everything in general. How do you navigate that?
It's not always easy, and we've definitely experienced those. And I think we basically what we've tried to do is like always come back to like we really respect each other. We both know what we want Bloom to be.
Mm-hmm.
And there's been times where we've had to be like, oh, it's getting a little heated or I'm getting really frustrated. Like, let's take a break and we'll come back to this. Like, and usually that little bit of time to like let off the steam of like, I feel like I was right here, or, you know, I think we should have done it this way, or vice versa. Like her and I like see things very differently. A lot of times we joke that we're like arguing about something and we're arguing about the same point, but like the way that my brain sees it and the way that her brain sees it are different, but we're actually arguing the same thing. And so we've done a really good job of like trying to understand where each other's strengths and weaknesses are. And like there's times when like what my strength is might be like more fun. And like she's like, well, it sucks that I'm the one that's having to do like this back end stuff. And so we've tried to stay like as open with communication as possible. And then like that's not always easy. And we definitely have had our moments where we're like, okay, you're kind of being a bitch right now. but
it's
you know,
fine.
and, like we're gonna take a deep breath and like go back around. Like but we've worked really hard on like again trying to remember that like at the end of the day, we really respect each other and we really align on what we want this practice to look like. And that's always kind of been the thing that's kind of saved us, I think, when we've had some of those arguments, and we've definitely had them. I think too, the farther you get out from the like truly startup phase, the less those things come up, right? Like nowadays, like we have a really solid foundation and we have most of the like startup-y stuff done, right?
Your systems are in place.
Yeah, exactly.
Like,
the systems are huge.
You're not stressed about building the systems or figuring out how to build the systems, and your team's growing, and you guys are getting
and we had
so
the
much
systems
bigger.
in place before our team grew, which I think is such a godsend. Honestly, actually, we just had our first provider start last week, and it was such a surreal moment. I was like kind of crying to my husband because I was like, when we started this practice, I like the only thing I could even fathom was that like I would never have to go back to urgent care. I didn't even ever think like this would be a practice like where there would be other providers there. Like Catherine and I have always said that we don't want this to be some big gigantic practice because I think it's really hard to keep the type of quality that you want when you scale. And so for us, it was really important that we kept that quality. And like that does mean that we're going to like cap out at some point, and we actually would prefer that to us being, you know, like an FMI or something that's like this big gigantic machine. And so I was kind of like, it felt so surreal being like, it's so crazy to me that like there's now somebody else that like cares about this business as much as we do. And like, I never even imagined that we would be in this position. And so it's been really, really cool and very surreal, like especially this week with her starting, that we've not only now can sustain ourselves so that I don't have to go back to urgent care, but like we're now building something that like other people believe in and other people want to be a part of. And like that is just such a cool piece of it. But being somebody's boss is really hard too. Like that's the other piece of it, that like the medicine piece of it is not easy, but like that's the piece that I know
your bread
really
and butter.
well.
You
exactly.
know,
I know what I'm doing. I know that I can care for women really well. The having to like tell somebody when like their schedule is and like, those kind of then like have negotiations over contracts and like those kind of things. Like again, those were stuff that like I didn't get any of that in school. This is the stuff we're figuring out. Like when we had to negotiate her contract, it was like this funny back and forth of like, we thought we were doing so good. Like we looked at all these comps and we did all this stuff. And then she was like, oh, that was not at all what I was like thinking I was going to like look at. And we had to like figure out a way, you know, to move forward together. Right. And to like find out what would be valuable for each party. And like those kind of things again are like stuff that we are figuring out as we go, like for sure. And you learn from each of those experiences. Like we have made some purchases, luckily nothing like crazy huge, but like stuff that like we thought was so cool, right? Like we went to a conference and we're like, oh my God, this is gonna be amazing. Our patients are gonna love it.
We need it.
It sits in our closet, right? Yeah. Like, so luckily we've made enough of those like on the fly decisions that have never been like big sink or swim things, but you do like, you learn as you go a lot of the times, especially in a business that's not like a traditional. Exactly. Like I'm sure you've had those experiences too, where you're like, I really thought this was going to be a really good idea. And that like really didn't go the way that I thought it was going to.
Totally. And then ultimately it always comes back onto yourself too.
Yeah,
or like you and Catherine at the end of the day, it's like, okay, well, this didn't work. So what am I going to do to fix it? How am I going to fix it? Because looking around, no one else is going to come.
No, nobody's saving me here.
No one's saving me.
Nobody is saving me.
Great. Yes. So excited. Yeah. But you mentioned like the quality of care for your patients at Bloom. Yeah. Walk me through your traditional, like someone comes through the door. How do you even start with your patients? Because it's so unique. No one does anything like this.
Yeah. So we are a full women's health practice. So we always say that, our goal is to be your healthcare home. And I do actually think this is one of the hills that I'll die on, and I'll have several hills today to die on, I think. I do think that women should be treated as a specialty. We'll kind of get to this, I'm sure. I've got some awful but amazingly real women's health statistics for you. But like for the majority of medicine, women have been treated like little men, right? And we just kind of have all this research on men, and then we just kind of assimilate it to women. Like, oh, you're just like the smaller version. Like that's probably going to be fine. And it doesn't work very well. Like we know that, 80% of people that have autoimmune diseases are women, right? We live in poor health for longer than men, even though we live longer than them, right? Like it just doesn't make sense for women to be treated just like men, period, across the board. So we decided that you actually do deserve to be treated by somebody who's only treating people like you. And so I don't treat men anymore. I don't treat children. I do treat some adolescent girls, but I don't need to worry about men's health. I don't need to worry about well-child check schedules. Like everything I'm doing, all my time and energy and education is going towards something that actually matters for your body, which means I'm really freaking good at it. And like, it really matters to me that I'm really good at that. Right. And so when a patient walks in our door, the way that our practice works outside of the conventional model, and again, unfortunately, that is because reimbursement rates have just gone down as everything else has gone up, which is why all of your appointments are getting shorter and shorter and shorter, right? Practices are having to see more patients to keep their doors open to be able to make the same amount of money, right? And so we kind of flipped that on its head, and we were like, okay, well, if we could pull the insurance piece completely out of it, right? They don't get to dictate how much time I spend with my patients. They don't get to dictate what labs I draw, what medications I choose. What could that look like? And so we kind of landed on a membership model. So very similar to like Culture or, a gym membership or Netflix. You know exactly how much you're paying for your care, and what you're paying for is your time with your provider. And that allows us to not only know exactly how many patients we have on our panel at any given time, to have a much lower panel and to spend a lot more time with our patients. So when I was practicing in primary care, I was expected to have 2,000 to 3,000 patients at any given time on my panel. And you just can't know. You can't know anyone well when you have that many patients.
You can't even remember names.
No, exactly. And that's why when you go to your doctors, you're like, oh, so-and-so, this happened. They look at you like, I have no idea.
Yeah.
And they don't have the time in between those appointments to look you up beforehand. Yeah. And as a provider, it felt like very unsafe medicine. Like I remember like having trouble sleeping at night because I was like, I just wrote this prescription for somebody and like, I barely know them. I saw them in 5 minutes and I'm never going to probably see them again. And like, that feels really scary as a provider,
100%.
Like the level of liability and responsibility that I feel
as a human
being and as a provider was like not something I was comfortable with. So we cap our patient panels at 200 per provider. So a tenth of what the normal panel size would look like. And so when you ask me a question, I actually know you well enough to answer and you have direct access to me. So it's not just, this big pool where like MAs and nurses and covering providers are all answering whatever question you have, or you ask a question, they're like, well, you need to make an appointment but we can't get you in for 6 months, but I can't answer that right over the messaging portal. Like I know you well enough and I'm seeing you frequently enough to be able to answer that. And I don't have to drag you in here a lot of times to answer a question or make a change to our plan. So we see our patients usually a lot more frequently too than you see. Most women are seen like maybe once a year unless they get pregnant. And then they're seen a bunch.
Yeah.
And then they deliver the baby and they're like 6-week checkup and come back when you're pregnant again.
Yeah.
And for most of us, that's not very good care, right? we always say like, it's really nice for us to see you consistently so that we can deal with stuff as it comes. And we don't have this laundry list of things at your 6-month or 1-year checkup to have to like backtrack, right? If we deal with stuff as it comes up, we've got this. Like, it's so much easier to tackle as it comes up.
Totally. And it's like women's bodies change so much all the time. What we go through in a month is like, let alone what like men don't go through in years. Like it's like everything changes all the time. So like you really do have to be seeing that regularly. It's not just like, oh, you go through puberty when you're 14 and you look like that the rest of your life. Like literally every year is so different.
Well, and we don't learn a whole lot about our bodies, right? We talked about this earlier, but we are not getting education about our bodies in school. I just had a mom reach out to me the other day saying that they're pulling the puberty conversation from elementary school and literally was like, if I can get a group of moms together and daughters, like, would you come teach them about their bodies? And like, that is insane to me. That is women, you know, most of us were taught like, you're going to bleed once a month and don't get pregnant.
Yeah.
But one, we don't even get taught how you get pregnant. I will tell
you can.
We have a very robust portion of our practice that is fertility. And the amount of 30 and 40-year-old women that come to see me that are fertility, like hoping to get pregnant, do not know anything about their menstrual cycle. And I'm like, you do realize that you can only get pregnant during a very short window if you have a very regular cycle every single month. And that is something that we are not taught.
Yeah. And it's really not that regular. No. Using words like regular and irregular when it's...
Exactly. And regular to who? Right?
Exactly.
No.
Some man who decided that.
Yes, exactly.
100 years ago.
Exactly. Well, and again, like we were talking about, like women are cyclical, right? Like in a quote unquote very normal regular cycle of about 28 to 32 days, our hormones change throughout the month. Men are a 24-hour cycle, right? They are sweet, consistent. We love them for that and hate them for that, right? Like love that for them. But as women, like we have changing hormones throughout the month. That means that we're going to have changing moods. That means we're going to have changing libidos. Like if you think about it, like if you think back to biology, right? Like our libido is supposed to peak around ovulation. Like we're not supposed to be horny all month like our husbands or our partners because men are supposed to like biologically spread their seed, right? Like, so our libidos actually should be cyclical too. And that is actually pretty normal, right? But we don't talk about that, right? Women don't get that expectation. Men don't get that expectation of our bodies. Like they don't learn anything about our bodies either.
Yeah.
So we're all just kind of like fumbling around with what we think is normal. And there's not anyone there to guide us or to help answer any of those questions or walk that path with them. And I think women so often function at such a high level and just continue to function. Like I always tell patients, like, you know, I get patients all the time that are like, well, I don't feel that bad yet. And I'm like, how do you even know? Like you are doing drop off and pickup and lunches and your full-time job and all these things. And like you're running yourself ragged and you kind of are just kind of used to how this feels. Like you're probably not going to even know that you feel better until you actually feel better.
Exactly.
And there's a lot of pieces of it that like aren't on me as your provider. Like my job is to give you the education. Like I can't sleep well for you. I can't feed your body. I can't move your body. I can't, you know, do some of these things that I'm asking you to do.
And you're like, I wish I could, but I actually can't.
Like, it would be great. And I have to practice what I preach too. And it's hard to do it for myself, right? It's really easy to give people these recommendations. It's hard to practice it as a working mom, especially. It is really hard to practice some of these things. And so I think, again, being treated by somebody who understands the season of life that you're in. I think as women, we have seasons throughout our cycle and we have seasons throughout our lives. And being treated by somebody who's also going like, May sucks. Like I have 900 things on my list and like I'm barely keeping my head above water right now. And it's nice to hear that like I'm not the only one doing that, right? And so our hope was that we were building a practice where women felt heard and seen and they got to be the main thing, right? We're not an asterisk in somebody else's care anymore. We are the whole point.
Exactly. Preach. Love it. Like,
it's so cool.
Yes.
I seriously, Catherine and I joke all the time that like, this is such a pinch me moment that we actually get to provide this type of care. Like, this is what I get to go to work to do all day is like so incredibly surreal, to be honest with you. Like, it is so cool to me that I get to do this all day.
And these are the conversations women should be having and everyone should be having, like, without any prior stigma, knowledge, whatever. These conversations should be happening. What are some of the conversations that you see with your patients out in the community, in public, whatever, that you think women should be talking more about that women don't talk enough about?
Oh, okay. I love that question. I think I see a lot of themes. So one is like that throwing up before my period or those horrible period cramps that I have are like normal or like a badge of honor almost, right?
Yeah.
Like, and that's just normal, or heavy bleeding is just normal, or the fact that like my cycles have been irregular since I was a teen are normal. And I think, what the type of medicine that we kind of leaned into in our conventional sense system is a very triage approach to medicine, right? So same thing, like when we look at like lab values and those kind of things, when we look at the side of like a LabCorp lab report, it doesn't actually say normal or healthy. It says reference interval, right? Which is actually just 95% of people probably fall somewhere between this low end and this high end. If you are somewhere in that very broad range, you're probably not sick enough yet for us to need to treat you. So you get triaged to you're fine, right? That's like just you're within normal limits. And yet there's so much nuance to like actual health, right? I think there's a difference between a disease state and a health state. And I think we have focused so heavily on waiting until somebody is in a disease state to then treat them for the rest of their life. Where as women, I think, again, we are constantly prioritizing everyone else around us. And I think we hold a lot of that, and we are oftentimes the last priority, and especially moms, right? I keep coming back since it's Mother's Day, but you can't pour from an empty cup, right? And I think that's something, prioritizing ourselves and prioritizing our own health can be really difficult for a lot of women. And a lot of times we go like, well, I'm fine. I don't feel that bad yet. I get that all the time from patients. Like, well, I'll start hormones when like I start to feel bad. And I'm like, what? Why would we wait until you feel bad, right? Like one of the, analogies that I use with my patients from a hormone standpoint often is, if your pancreas stopped making insulin, nobody would ever be like, well, that's natural. Don't take any insulin. But that is a hormone, just like progesterone or estrogen or testosterone is. And yet for some reason, because women can physically live post-menopause, we just expect that that's natural, and that's the natural way to do it. And it's normal for our bodies to not have those.
And it's funny that you mentioned that with hormones, because then I think on the fitness side of things, like I think about men taking testosterone and they're bragging at the gym about how big their muscles are getting. And they're like, oh, I'm on T and all these things. And then for a woman to say that, everyone would look at her sideways. Like, wait, why would you do that? Why are you talking about that?
Yeah.
So I think that's so interesting. Just one of those big differences of like almost bragging about it versus being like, oh, well, I'm not sick enough yet for it.
Yeah. Or I'm like, for some reason, there's something defective about me if I'm replacing this. The other thing too that's so frustrating to me is testosterone is FDA approved for men. You can get it covered by insurance. Cialis and Viagra, FDA approved for men. You can get it covered by insurance. But yet almost all the things that we do in women's health are considered either off-label or not covered by insurance. And so again, that's where this kind of boundary is of like, do I let them dictate the care, right? We know in medicine that guidelines are always often so far behind practice and evidence, and guidelines are what the insurance standard is set on. And so that's what is covered. And it's just so mind-blowing to me that like things get covered for men like that. And as women, again, it isn't. Even like getting estrogen and progesterone covered sometimes is a nightmare. And yet like a man has low testosterone, everybody will instantly be like, oh, here you go. Let me prescribe that for you and let me cover it. And here's also some Cialis while you're at it for, a zero copay.
Yeah.
But yet the females that I'm treating for like recurrent UTIs or menopause symptoms, that is like pulling teeth to get something covered. It's just mind blowing.
And just like sitting down and having, I'm sure it happens multiple times a week where you're sitting down having a conversation, even about something simple like cycles, and being like, I get to educate you, and like, thank God you walked through that door, and like, I have the opportunity, but like, oh my goodness, people are out here like thinking some of these things.
Oh yeah. And it's being perpetuated, right? Like that's one of the things I think too, that was really important to us was like the education piece of it. And I think that's where, things like social media and Instagram and like getting to be on podcasts like this have been so valuable, is like, this should be what women get access to. This is what the conversation should be. And it's not, unfortunately, what we're getting, right? Like one of the conversations that I have almost daily, I think at this point is, women were not included in clinical trials until 1993, which means a lot of the drugs that are at market right now were never even tested on a female body. A lot of times research says, well, using female studies or female participants in studies is really difficult because their hormones fluctuate too much, and that screws up the data. And I'm like, women are 51% of the population of this country, of this world, and you're telling me that our hormones fluctuate too much, that it screws up the data, and that data is not important, that's not valuable to understand if we're over half of the population.
And again, like, duh. Like, you would think, like,
yes.
duh, our hormones fluctuate. Yes, like, when you want more
Then we should
participants
know
to
about
study,
that. Yes, then we should study that. Don't you think? Is that crazy? Well, and like the other thing, right? In pediatric medicine, we use weight-based dosing for almost all of the dosing, right? Like, I know you know
100%.
this. The second a woman turns 18, she is now an adult. And we have standard adult dosing for 99.9% of medications. So I am 5'1". My husband is 6'2". You're telling me that me and my husband should be on the same starting dose of a blood pressure medication? You're telling me that antibiotic that you're prescribing to me should be the same dose for both of us? How does that make any sense? We know even when we compare women and men that are the exact same weight, our body composition is so different that we still metabolize drugs very different, even when we put them at the exact same weight. And yet we just have male dosing.
Yeah, no, not even female doses. We're actually not even there yet. Just straight male dosing.
So Ambien is one of the only medications that we have that has a female starting dose that's decreased, because so many women were driving their car after taking Ambien and like killing people, to the point where they were finally like, why is this only happening to women?
And they probably just went, okay, we're going to like half the dose, and women can start there.
Decrease the dose. And they're like, well, there we go.
Yeah,
But
that'll
if
solve the
that
problem.
is happening to the point where we're seeing it, and that, how is that not happening across the board? So one of the things that we utilize often is like decreased dosing for women. Again, I am 5 feet tall. I'm probably closer to a 12-year-old than I am a full-grown man.
I should be weight dosed.
I should be weight dosed, exactly. So like you're telling, like, so many times I will use like a compounding pharmacy or something so that I can decrease the dose, or else I take half of that tablet, even though the recommended starting dose is a full tablet. That's not for you. That recommended dose wasn't for you. And that's really frustrating that like I have to play this like guessing game of how do I back dose this for patients so that it's actually safe and appropriate for their body and not just assimilated from a male study.
And as a provider, being able to trust the medications you're giving and like trust where your information's coming from is huge. Like having such a almost unique outlook on it. How do you and Catherine find your education? Because I know you stay up to date with everything all the time. Like anytime anything happens, I'm like, Dr. Amylia, what's going on? Like, what do we think about this? Like, I need your opinion. But how do you decide what information you take and use versus things where you're like, okay, that's literally someone just tested that on a man and like, whatever, that doesn't even apply to my patient population.
Well, and I think in the beginning it was really hard, right? Like, because the majority of the education that we needed, like I did a family practice degree, right? So the amount of time that I got educated on women's health was like an hour lecture on menopause. Like, here's the menstrual cycle, here's what menopause is, here's how we get people pregnant. That's pretty much it. And so a lot of our education has been, courses that we found outside of that. And it's frustrating because, I think hormones are now having their moment, which I'm so thankful for in one regard. And then I'm also terrified of in another regard. Like hormone clinics are popping up left and right. And I'm so thankful that women have access, but I also think that the level of like entry education that is necessary to treat this, like this is endocrinology, right? Hormones are endocrinology. People do full residencies.
I was going to say, people specialize in this. Like,
and yet you're telling me that a weekend course is an appropriate amount of education to then be treating women. I just had a new patient the other day who saw a provider, got her hormone labs drawn at a random time in her cycle and was told she had low progesterone and was put on continuous progesterone to quote unquote help regulate her cycles and get her pregnant. That was her main goal, was to get pregnant. And she did a discovery call with us and she'd been on it for 8 to 9 months. And I had to tell her that she was basically taking birth control because progesterone opens and closes our fertile window. You cannot take progesterone continuously and try to ovulate and get pregnant. And so she'd been, taking a pregnancy test every month, getting her hopes up. And she basically there was like a 0% chance she was going to get pregnant.
Because of what she was doing.
And because of a provider that was basically practicing malpractice, right? By saying, oh, I know how to do this and I will prescribe this for you. Like, I think that's one of both Catherine and I's biggest strengths is knowing when I am the right person to carry the ball and when I'm not. And I'm always the first person to tell my patients when I'm not the right person to carry the ball. I know what I'm really, really good at and I'm not doing the things that I'm not really good at.
Yeah, exactly. And being able to have your space and
Yeah.
almost like protection to be able to do that. And like, again, as a provider, as a nurse, it's so hard to admit when you don't know things
Oh,
sometimes because
yeah.
people look at you like expecting everything. Like someone will come to me like, Bailey, this is wrong. What do I do? I'm like, you're 20 something years old. You realize I was treating 2-year-olds.
Yeah.
Like you and the toddler in the ICU, not
Yeah.
alike at all. Your
No.
blood pressure, no idea what it should be.
Yeah.
Like,
Yes.
don't ask me these
Yeah.
questions. But like being able to be like, no, I have no idea. You need to ask someone who actually like knows about that.
Well, and that's like the safety component of it, right? Like it just is mind blowing to me where people, I don't know, I guess the ego and safety, you know, really need to be separated. And I think it's really important and really valuable to be able to say when you don't know something. I think too, again, because we were able to niche down and get really good at what we're doing, I'm really comfortable saying what I'm really good at. And I have my very own, like, we have like our own little Bloom study now, right? Where we are like, we have an N of, 200-300 patients where I've been drawing CRPs on every one of my patients. I've been doing these things. So I actually now have enough experience with the panels that we have that I can say like, I've actually seen this theme in our own patient population, right? And it doesn't always align with even what I was taught, right?
Yeah.
So it's, I think the clinical practice, I think we all learn that, right? Like what you learn in school and what you actually learn in practice can be very, very different. And I think that that's something that we're recognizing every day too. Even some of the things that we're reading about and we're doing, we're like, but that's not really aligning with what we're actually seeing in practice. And so how do we kind of bridge that gap of like, this has worked really well in practice, but this is kind of what the recommendation was. And we're trying really hard to build some of our own protocols, I think. And I really don't love the term protocol because I feel like then people just get dropped into it, right? Like, oh, you go to a functional medicine doctor and they're like, oh, well, we have a SIVO protocol and we have this protocol. And if you just fix your gut, everything will get better. And like a lot of times for patients, that's not the case, right? People are complex, women especially.
Yeah.
And how I treat one patient versus how I treat the next is probably not going to be the exact same, even with a very similar chief complaint, because we know that there's a lot of nuance to our care.
What are some of the biggest like symptoms that you see that women push off for too long? Like we were talking about the really heavy periods being like, oh, well, it's been like this forever. Like what are some of the things as you're building up, like the information you have with your patients, you're learning, you're seeing these trends over years now. Like what are some of the biggest things where you're like, if you feel this, it's not normal?
Yeah. Usually I think a lot of us as women, especially that little intuition or that little voice, we were taught for most of our lives to quiet that. And I think it's something that I really hope that like I'm unlearning so that my daughter doesn't learn that. And I think as women, that's something that we're working on is like getting back into that intuitive space of like listening to our bodies and not dismissing and quieting those like red flags that are going off, behind our eyes. But things that I see really often, I tell patients this every day is like your period is a vital sign. So if that is not regularly occurring, then something is off. I hate that we picked the term balanced, and I love balance. Hate balance for hormones. Hormones are not supposed to be balanced, right? If hormones are balanced, you're either on birth control or you're in menopause. Balance is like this flat line, right? The way that I explain how our hormones should look to patients is it should be like a symphony, right? Each instrument should be making their sound at the exact right time for the whole sheet music to sound, the whole, symphony to sound well. And we have the sheet music, right? So I hate when I hear patients say often that like my OB or my PCP said, well, we don't draw hormones because they're always fluctuating. It's like, but we know where they're supposed to be, right? We actually know like what is your estrogen supposed to look like in your luteal phase versus your follicular phase. And again, if we know where you are at in your cycle and we know what your cycle is doing, then we can say, this is where you should be and this is where you are. And we need to figure out why that's not happening the way that it's supposed to happen, right? It's not supposed to be balanced. It's supposed to be a symphony. And I think that that's something that we have really stepped away from. Like women come with, heavy periods or cramping or irregular cycles or brain fog or weight gain. And again, in the triage system that we have, we go, okay, well, here is birth control. This will regulate your cycles. This will fix your symptoms. And one, I don't really feel like that's very informed consent because if I only give you one option as a provider, that's not really a choice, right?
Yeah.
Here, keep doing what you're doing, or here you can have birth control. That's not really a choice, right? So one of the things that I always do with patients is I kind of set it out like the Goldilocks of options, right? Here are the safe options you have access to. And I'm going to tell you what the pros and cons of each are. And I will always give you like my clinical judgment on what I've seen work really well. And if your CRP is through the roof, we're probably going to need to be a little bit more aggressive to move the needle, but you can still start here. And this is how we're going to check to see if we are making progress. But that is actually your choice. And it is really important to me that you have choice in what you decide with your body. And I think that that's, again, a piece that we have really strayed away from in conventional medicine just because of time. We don't have the time to have conversations. Most of the time, I just saw something on Instagram this morning and it was saying it was a piece of paper that had been sent out to a patient prior to their annual wellness exam, right? Your pap smear. And it said, these are the things that are included in your annual GYN wellness exam: pap smear, pelvic exam. If you have any of these complaints, you may be charged a copay because these are outside of what is covered in a wellness exam. PCOS, family planning, irregular cycles, breast pain, any of those symptoms are outside of normal. But yet those are things that women are having concerns about throughout their entire life. And why is that not a piece of the discussions that we're having? We should be screening for those at that wellness exam. How is that considered a wellness or preventative exam if we're not making sure that you're not experiencing symptoms?
And someone's going to experience multiple of those symptoms multiple times throughout their life, no matter what stage they're at. So if you're not even looking at it once, let alone in different stages of your life, how are you supposed to know what to expect or move forward or be like, hey, this is what I should be looking at. You're not even educated on what to look out for half the time.
Well, and things like PCOS, right, are so frustrating because it's just a cluster of symptoms, right? And we have so many. There's actually a really cool study that came out recently that talked about the different subtypes of PCOS, right? We see like lean PCOS all the time in practice because we're actually looking at their labs and we're doing ultrasounds and looking at their follicles. But if you don't look a certain way, if you don't fit this picture that we have in our model of what something does or doesn't look like, you immediately get put in one category or the other. And your symptoms either get completely denied and dismissed, or you get a diagnosis based off of what you look like, and that might not be very appropriate either. And again, it's just this really frustrating undertone of male-centric medicine that has
of course.
I mean, and that's what it started as, right? Yeah. I'm reading this book right now called The Unwell Women, and it talks about how, this is ingrained in, unfortunately, not only our history in the US and the UK from a political system, but also from a medicine system, right? Women were not allowed to be physicians in the beginning. We were not treated like male patients. We were treated like this vessel for having children, and that was pretty much the extent of what we were valuable for. And like that has permeated our education. And it's really wild that in, 2026, this is still happening, but it very much is.
So for people who are listening and are like women and girls and they're like, I need to know more.
Yeah.
What would you say next steps would be?
That's a great question. So locally, we are still accepting new patients. I always say, you are more than welcome to start with your PCP or somebody that you trust. And I think that trust is a really, really important part of a provider-patient relationship. And if you have somebody you trust, I love that. Like, go to them and say, this is what I'm seeing. I always tell patients, I'm like, you do have to be your best advocate. Like, not everybody has the time and the energy and the understanding or the education to advocate for you. You have to be your first advocate. And when you advocate for yourself, I need you to listen to that voice inside. And if you are being dismissed, it's time to go. It's time to find the next person. You need to continue to advocate for yourself. And it's really frustrating that women usually have to do that multiple times, right? It takes 7 to 10 years for most women to get a diagnosis of something like endometriosis or PCOS. And that's BS, right? That should absolutely not be the case. This is not a time is not a piece of the component of a diagnosis, right? For any of these diseases, it's because women are not being heard and our concerns are not being validated. And so you have to be your best advocate. And unfortunately, that probably means that it's going to take a little bit of time to find somebody that is willing to listen. But when you do find somebody to listen, that's when the magic happens. I think that's when we can start kind of the ball rolling. And my hope is that, again, as hormones become more popular, as we're having these conversations about women's health, that this is going to become the norm. I would love this to be the standard of care for all women. And that is, my goal personally and within the community that we're in. But it's not yet. Unfortunately, like, again, I have a daughter. Like, my biggest goal with this practice was that she does not have to walk the exact same path that I walked. And hopefully that the standard of care that she receives throughout her lifetime is going to be eons better than the kind of care that I've received over my lifetime. But I think being your own advocate is always the best place to start. And it can feel really infuriating as women, but it's a necessity.
Yeah. Yeah. I love that. 100%. And I always joke, I always say like, well, someone has to do it. So I guess it's me. And
Yeah,
it's
and
you and
isn't that-
Catherine.
yeah.
Someone's got to do it. And you know what? It's you guys. And you're setting a perfect example and such strong role models of taking your gut feeling, your intuition of like, hey, this isn't right. So I'm going to go do it my way. And not that I'm saying it's the right way for everyone and everything, but like for people out there, it is going to reach them and it is going to be the right thing and it is going to help them in the long term and like make them feel validated and seen and heard and genuinely overall help their health and educate people. And that's the best thing you can do is like spread the word and educate.
And I also tell patients all the time, like, I'm not the right provider for everybody. We all have personalities. We all have certain things. And luckily in our practice, Catherine and I, again, are very different. And so if I'm not the right provider, she probably is. And that's really nice. You can still like, it works out really well for everybody. But like, it's really important that like, as a patient, you are advocating for yourself that like, if I'm not the right provider for you, even if I'm the most well-educated provider in the room, I still might not be the right one for you. And that is actually your job to figure that out. My job is to be the best provider that I can be, but I'm not going to be the right person for everybody. And that's okay. And my job is to understand, you know, I always joke with patients that I'm like the quarterback. I love sports. So this analogy with my female patients doesn't work all the time, but I'm like, my job is to be like your quarterback, right? My job is to see like the whole field and to know when I'm the right person to carry the ball and when I'm not. And again, there's going to be times when I'm not the right person to carry the ball, but I will be the first person to tell you that. And I think that that's really, really important. I think that it's changing. I mean, I really have to hold on to the hope that like the momentum that I'm seeing with providers like Claire Haver and, you know, all of these kind of ground roots movements towards women getting the type of care that they actually deserve is really exciting to me. I think we still have a lot of room to go. I think that the bar is still really, really low for the type of care that women are receiving, but I think it is moving and I think it is moving in the right direction. And that's really exciting to me.
I love asking people this question. If you had one absolutely delusional goal for Bloom and if there was no bar, if you could do whatever, infinite amount of money, anything, what would that delusional goal be for Bloom?
Oh my gosh, I love that. I always tell patients, I'm like, if you had a magic wand, and, you know, like you said, like, I love that. I think that would be that this is the standard of care that all women receive, whether that is through the insurance model or some other type of, you know, private pay or socialized medicine, whatever you believe in. This should be the standard. This is the standard that I'd want for my sister. This is the standard I want for myself. This is the standard I want for my daughter. This should be the bare minimum standard of how every woman is treated. They are educated on their bodies from the get-go. They are treated early and they are listened to and they're an active participant in their care. And that should be the absolute bare minimum that every woman receives. And that would be my, like, if that is what I accomplished in my life, I would feel so accomplished.
That's amazing. It's also funny thinking about like myself personally. I'm like, I'm a nurse. I have a nursing degree. I worked with kids for how long? What do I even know about my cycle? And like, it honestly makes you think and reflect. And I'm like, we got one semester where women's health was grouped into pediatrics. Like, I can't wait to go home and like actually look into some of these things and be like, wait, like even my own education, I'm like realizing isn't up to where it should be. And I absolutely love that that's what you're dedicating your life to and your business and all of your goals. And I think that's absolutely amazing. With all of this, how are you balancing that with being a mom of two and a wife and a friend and a sister and a daughter and all of these things?
All the things. I'm not. So we talked about this for a second before we started filming, but I believe it was a Nora Roberts quote that I have held on to so tightly in this journey of entrepreneurship and motherhood and all these things. And what she said was, you know, there's always going to be balls up in the air. And the most important thing is to recognize which balls are glass and which balls are plastic, because you are going to drop balls. And I think in the beginning I was chasing balance, right? I was chasing this idea of being the, you know, perfect 50-50 of business owner and wife and mother and all these things. And I was running myself into the ground, and I felt like I was dropping the ball everywhere. And I never felt like I was doing any of it very well, right? So now what I chase is presence. So when I am at the office, I'm trying to be as wholly present as possible. When I'm with my patients, I try to be as wholly present as possible. When I am leaving the office and I'm going to pick up, or I am, at home with the kids over the weekend, I try to be as wholly present with them as possible. And that is really difficult. I think in the type of world that we have right now, right? We were talking about like our cell phones and being so connected to each other and all these things. And so one of the things that I've done recently is like trying to plug my phone in the kitchen and like leaving my phone there so that when I'm with my children, they are getting as much of my undivided attention as possible. And like, that's never perfect either. But yeah, I think I think if you chase balance in motherhood, oftentimes you're going to feel like you're falling short. And so I'm currently chasing presence.
I love that. Something that just came to my mind that I remember from when we talked about months ago, and something that you're implementing with your kids that I thought was absolutely amazing. It made me think of that when you said with the phone thing, was when you get your cycle, what your husband and your kids do. If you're okay with sharing, I love the story and I think it's absolutely amazing. And I think everyone should be doing this. So I would love for you to share that.
So I have a wonderful partner. He is phenomenal. And, he was raised by a single mom. And again, I think this should be the absolute standard. I don't think he should be a unicorn. I think, again, sometimes men are held to a very low bar as well. But he is amazing. And he actually, I'm not going to take credit for this because he found this on TikTok. And one day he said, okay, the first day of your cycle, I'm going to make steak because you need iron. I'm going to get you pomegranate juice and I'm going to get you dark chocolate. And every first day of my period now, my kids know that we are having steak. Mommy is on her period. They always joke anytime they go by the butcher with my husband at the grocery store, they're like, is mom on our period again? But it is like such a normal thing. And like, I remember growing up, like I wasn't even allowed to keep the tampons like on the top of the counter. Like they had to be underneath because that was like dirty or gross or something. And it's like both my daughter and my son, and it's really important to me that both of them are seeing this get normalized. That is a normal part of our family life, is that mom gets her period. And like when my daughter gets her period for the first time, like this is going to be really normal. Like, okay, we're having steak and we're getting chocolate. And like, that's just a normal part of being a woman. And it's important that both women know that and men know that. And it's honestly become like one of our favorite days in our house. And it is so funny that it seems like so wild to have that conversation. Like I told some of my girlfriends at mom's night the other night and they were like, oh my gosh. And I was like, it feels really normal now. Like, and I really like that. And I think that again, like those are things that we can do in our own households that are going to help that next generation, right? I keep thinking about like the type of boyfriend or husband my son is going to be, right? When his first girlfriend gets her period, he's not going to freak out. He's going to be like, oh,
steak and chocolate.
Steak and chocolate. Here's my sweatshirt. Like,
no, exactly. And I think that totally comes back to, it starts at home. The 100%. Education starts at home.
Yeah. Unfortunately, I wish that. Yeah. But yes.
And little things like that are changing everything for everyone. And they're going to tell their friends at school about it.
Yeah.
And they're going to start doing this themselves and their kids. And hopefully it passes on. And I hope it's a new trend. And I hope that your husband started this and it blows up, because like that's what should be happening. And then there's no awkwardness. You can have those conversations, and that leads into more difficult conversations as they get older. When you're talking about sex, when you're talking about libido and different things like that, if you can't even have the tampons on the first shelf, how are you going to be having these way harder, difficult conversations that could result in serious things? Like you need to start with that as soon as you can, because then it's going to be normal throughout their life. And then that's one less thing they have to worry about on top of education and everything else that we have to worry about on top of that.
Now. Yeah. Well, and again, I think it's, trying to give them the education that they deserve in a way that they can actually understand it, right? I say that with patients all the time too. Adult women, I can be the smartest person in the room, but if I don't explain this to you in a way that you can actually understand it, I am not doing my job, right? And I think oftentimes we have this difficult kind of dichotomy with children where it's like we either talk way too high level and they don't understand it, or we act like they're too young to know any of it anyways. Like I remember a mom one time told me that she wasn't letting her boys watch the Red Panda movie. I don't remember it's a kid's movie. So, but it's, oh my gosh, what's it called? But it's got a red panda, and like the whole idea is like the daughter is getting her period for the first time. But it's like a cartoon. So they don't actually talk about periods. But she was like, well, I don't want my boys to watch that. Like, they're too young to know about that. And I'm like, they're too young to know about.
You're like, do you know who you're talking to right now?
This was right before I was even doing women's health, but it was just like mind blowing to me. I'm like,
yeah.
But you had to get a period to be able to have those two children that you were so worried about them knowing about. Like that is the stigma. That's the problem. It's not the period. That's the problem, that we have to have periods. If we do not have periods, we do not procreate.
Yeah.
And guess who comes from procreation? Men. Like, you guys can't get here any other way. Like, yesterday I saw a cool quote, and it was like, the only people on the planet are mothers and their children.
Yeah.
And I was like, whoa, that's pretty crazy.
Think about that next time you have to test out a new medication.
Exactly. Yes. But so, yeah, I think it's really important to me that, again, like, this should be the bare minimum. This should be the standard of care. Like, this type of education should be the standard of care. The fact that, like, we're not teaching girls about puberty in elementary school is mind-blowing to me.
Mm-hmm.
This is a part of their bodies.
Thank you so much for coming on Balance with Bailey. I absolutely love everything you shared, and I can't wait for everyone to listen and just learn and have these conversations, have these hard conversations. That's why we're here. For Bloom and for yourself, plug your socials. Where can we find you?
Okay, so on Instagram, Bloom is BLOOM.WH. Bloom Women's Health is already taken. The fun pieces of socials, right?
Of course.
And again, we're really big on trying to provide education and connection and value. So you can find and follow us there. And there's a link to our website, which is www.bloomwh.com. You can book your first appointment. You can learn more about our practice and what we're trying to do for women. My Instagram handle is at Dr. Amylia Shayne. I try to share as honest of a representation of what my very busy, full, chaotic, wonderful life looks like. I think it's really important too, as women, that we're remembering that oftentimes we're seeing other people's highlight reels, right? And we're comparing our real life to other people's highlight reels. And so I try to show little glimpses of what life looks like in and out of those highlight reels. And yeah, I mean, please reach out personally, reach out to Bloom. It's really, really so cool to me that this is what I get to do today. Like, that this was a part of my job, and my life is just so surreal. And so I really, really appreciate you having me. I really appreciate the conversations that you're bringing to everyone, especially women. And if I get to be a part of that conversation, I'm just so fortunate. Thank you.
Of course. Thank you so much. Genuinely, you are paving the way for women's health, and I can't wait to see and be a part of everything that you get to do.
Yes, you're coming along with us.
Yes, of course. And for the rest of you, make sure you like, comment, subscribe. We're on Spotify, Instagram, YouTube, TikTok, the whole shebang, everything. And I will see you guys next Wednesday. Bye.
Bye, guys.